everyone. I'm Emalyn Lascuña, BEd 1D. And today, we are going to talk about one of the most important topics related to a pregnancy, which is prenatal care. What is prenatal care and how prenatal care is important to a pregnant woman? Based on my experience while I was a midwife assistant at CHEM Birthing Center, prenatal care is a health care provided to a woman pregnancy. It consists of serious clinical visits and ancillary services designed to promote the health care and the well-being of a mother and the fetus. It was existed for over 100 years as an approach to improve the maternal and the newborn outcomes, and also help improve the infant health by identifying conditions that can harm health such as low weight gain and more complications. Based in my research at www.bbmchealth.organization, they said that every woman wants to have a healthy pregnancy, putting us a little stress in the baby while it's in the womb is important, and it's there with an excellent prenatal care. Prenatal care can reduce complications during pregnancy and prevent problems during delivery. Regular medical care during pregnancy provides you with vital information about the changes of the body that could put the pregnancy or your health at risk. Ideally, when to the prenatal care early to the pregnancy and regular medical care. Prenatal care is especially crucial for a woman with a higher risk pregnancy with a higher complication called higher risk. And these are the factors that may increase the higher risk problem during pregnancy. First, young and overage pregnancy. The babies born to a mother under 20 years of age may face the higher risk of low birth weight, preterm delivery, and severe neonatal condition, while the babies born to a mother over age have a certain complication, more likely include premature birth, birth with defect, and getting pregnant with multiples. Second, overweight and underweight pregnancy. The babies born to a mother with overweight or obesity are at higher risk for health problems, including neural tube defect and heart valve defect. And the babies born to a mother who are underweight is possible to birth premature. Last, problems on a previous delivery. The mother with a previous pregnancy problem, there is a possible she experiences during her present pregnancy. And this complication can be prevented or treated if you have an early and regular prenatal care. So what happens during prenatal care? At your first visit, your doctor will ask you a question about your prior pregnancies, previous operation, and any diseases. Providing your doctor with complete health history during early prenatal visits gives him or her the information needed to make sure to get the best care possible during pregnancy. Your doctor will perform a physical exam, take your blood and urine for lab tests, and check your weight, height, and blood pressure. Your doctor might also do a breast exam, pelvic exam to check your uterus, and the cervical exam including pap test. Subsequently, visits will include checking your baby's heart rate and growth. Will you also get to hear your baby's heartbeat and ask questions about your pregnancy during prenatal appointment? Regular prenatal care is important because during your routine visits, your doctor check your anemia, preeclampsia, gestational diabetes, and the other harmful infections that may affect your pregnancy and your baby's health during your prenatal care, or your baby well monitored for problems that may affect her and his health. I have a situation related to my topics. It happened while I was working as an assistant of midwife at CHEM Birthing Center. We have a patient whose in first trimester had a complication in her pregnancy. First, I asked her how was her pregnancy. What were the strange feelings she felt while she's pregnant? She said, "It's okay, but his abdomen's aching." So when I heard about it, I immediately went to the midwife who assigned to the birthing center and told her about the patient's situation. When the midwife heard the situation of the patient, she immediately gave a referral for an ultrasound, and that day also, she went to BB2 ultrasound facilities, then went back to the birthing center where I work and gave the result to the midwife in charge named Miss Helen. She read the result and explained in front of our patient. Miss Helen told her the cause of the pain in her abdomen is it because her small uterus. Miss Helen added that her uterus would not grow as her babies grow inside. So she advised to the patient to visit a doctor specialist regarding to her situations, or else it will risk her life and the life of her babies. So this situation shows how important of having a prenatal care during pregnancy, and how prenatal care is important to a pregnancy. So let's look back to the situations I was sharing. Do you really think that the patient complications was cured? Well, the answer is yes. Why? Because she was able to get prenatal early, and the doctor found out about her complications, then give her an immediate medicine and treatment. So that's how important of having prenatal care during pregnancy. And for all those pregnant women who have not yet had a prenatal care, please have it. It is for your own good and to your child. And to those already begin, continue until you give birth. Because the hormones of the body change during pregnancy. And we don't know when there may be complication. And that's the purpose why you have to continue prenatal care until you give birth. And take note, prenatal care is not only for a pregnant woman, it is also help women who wants to be pregnant. Hopefully, in these conversations, I could share lessons that help you know how to make your pregnancy healthy, and how pregnancy related to prenatal care, or how prenatal care important to a pregnancy. So that's all. Thank you. But before I end this video, I would like to say thank you for Miss Jira B. Tumampos for these lessons and for being our subject teachers. Thank you.